All right, hey everybody. We're going to talk about EVDs, the supplies you need, and the setup, and also some tips and tricks. So if you go to your cart, go down to the EVD drawer, you can pull out your supplies. I made a diagram of everything you need, and also what that item is on the back. So first, you got your cranial access kit. This is what has the hand crank drill and all this stuff to enter through the skull. You have your EVD catheter. Depending on the doctor and also depending on the size of the bleed, I have put in 1.9s. This is the larger size for a bigger bleed, because if you have the smaller size, the ones, they tend to clot faster, and they'll need to be replaced sooner. 2 sets of gauze, sterile gauze, the larger Tegaderm, depending on your doctor's hand size, they're sterile gloves, a chip clip. We have some betadine, some Lido with epi, syringes, flushes, and some med drawing needles. You have different size sutures. You have some 2O and O silk sutures in here, and it should be enough for the whole procedure. Your EVD transducer, some sterile towels, a sterile gown, and your EVD drain. Now, a couple things that surgeons are very particular on is you want to ask them, do you want them to open up the drain and set it up for them, or do you want to open it up on their sterile field? Because out of the box, this is the drain is sterile. So a lot of the times the doctors want to set that up themselves while they're still sterile and not breaking sterile fields. You want to get a table, lay a couple chucks on it, and have it for them. Now, to set it up, if the doctor hasn't done it already, you want to connect the transducer to the drain. It really just comes off like this, and then it gets hooked up here. Some doctors want to flush the EVD. Just let them handle that. If they want to flush it, great. If not, it's no big deal. It's not something you want to do because you don't want to accidentally introduce fluid to the brain. They will also tell you how to, where to measure it. It's usually waters per mercury, or what, centimeters per water, and they'll tell you where they want it. And all you do is just pinch these 2 things and raise and lower it. To put this on the pole, there is a little squeezy thing that opens up these arms. You just attach it, and then you have these rubber bands to go around and clip in. But you want to do this last because you still have to zero it, and where you zero it is to the tragus. So you want them in their lowest position where they're going to be comfortable, head of the bed greater than at least 30 degrees. And you get your wire from your monitor, hook it up to the transducer, turn on your monitor, and on this drain, it comes with this level on a line, and what you want to do is you want to pull this taut on here, put it to the patient's tragus, and then you have this bubble, and you want it in between the 2 lines, and that is where you want it to be leveled. And you would to adjust it, just squeeze the clamp, raise and lower. And then right now this is set for art line, and you just want to change this to you click on this little icon down here, will bring up this. You click on the art line, change label, and you want to click ICP because that's what we're measuring for. So now we have the ICP. To zero it, you want to turn it off to the patient. Open this clear cap. You have it now open to atmospheric pressure to the transducer. You click on the line, 0 ICP, and then it's going to count down, and then you'll have a 0. That means you are now zeroed. You want to get the cap. Inside the transducer kit, it'll have a white cap that you just replace it with, and it should have 2 because you want to change this white cap and this other clear cap to the white cap, because these caps have a little hole in the center. Then you would, depending on if you want to read the ICP, you would turn it off to the drain. Well, you would open this up and then turn this off to the drain, or off to the drain, and now you should be getting a reading. Now to drain, after you get your reading, you want to drain it to the patient. You turn it off to the transducer. Turn it off to the transducer, and now it's going to the drain. And you can just take these rubber band things and clip them there. And that's it.